Hello, my name is Alison Carrion. Now I talk about Ivabradine, catecholamine-induced tachycardia in a patient with paraganglioma. Definition: Ivabradine is a novel red-lowering medicine for symptomatic migraine or stable angina pectoral and symptomatic chronic hair failure. Paraganglioma is a rare tumor that begins certain every cells that are dispersed throughout the body. This tumor can affect people of any age, but most often show up between the age of 13 and 15. The tumor is often slowly growing and not cancerous, but it can invade any part of the body, become cancerous, and spread distant.
Paraganglioma, as the name implies, is a tumor of paraganglia. Well, paraganglia are cells that are located in various parts of the body. These cells are located in the middle ear, up against the inner ear, and also located in an area called the jugular bulb. And if I were to look back at the back part of this model, I would see that the sigmoid sinus, this is a major vein that drains blood from the brain and empties into a large channel called the jugular bulb. This also has the same sort of cells that we're talking about in the middle ear, the cells called paraganglia. Well, the purpose of these cells is really to detect oxygen and carbon dioxide levels in the bloodstream and get that information back to the brain. Well, for unknown reasons, mutations can occur within these paraganglia cells and causing tumor formation. Most and almost all paraganglia are usually benign. There is a malignant variety of paraganglioma, and it's just referred to as malignant paraganglioma that can metastasize, that can spread from the ear to lymph nodes regionally and throughout the body. So it's important to make the diagnosis. Typically, the diagnosis is made by an astute physician who encounters a patient who has pulsating tinnitus and hearing loss, and a conductive hearing loss. And when they look inside the ear canal under a microscope, they can visualize the tympanic membrane, and they can actually see the paraganglioma behind the eardrum. This is what we call a glomus tympanicum. These paragangliomas also have another name, and that is glomus tumors. So these glomus tumors that arise in the middle ear are called glomus tympanicum tumors. Those that arise in the jugular bulb are called glomus jugulare tumors. These are just a difference in names, if you will, but really the same kind of tumor. A glomus tympanicum tumor, very easily treated with removal and excision. A glomus jugulare tumor is much more problematic, and treatment is really tailored according to the symptoms that the patients have.
Application in medicine. Case of a 54-year-old man with an intraocular metastasis paraganglioma, and in-home sensory radiotherapy with lutetion was indicated. He has hypertension, tachycardia that we were controlled with the use of phenobenzamine, metoprolol, and metronidazole, and his cardiac status and functional status were excellent. After one cycle of lutetion, he has hypertension and tachycardia was not controlled with magnesium, doesn't adrenal strictor, and calcium channel blocker, warranted immediate consideration of additional rate control medication. The administration of Ivabradine was started on the heart rate of the third day from 143 to 19.2 beats per minute.
Now, multiple MR images here demonstrate a large mass in the left upper quadrant. Now notice that this mass isn't arising from the adrenal gland. It's probably just arising from the retroperitoneum. You can see that it's T1 hypointense, T2 bright, and demonstrates avid enhancement. Now, if it was coming from the adrenal gland, I would say that it was probably a pheochromocytoma, but this isn't coming from the adrenal. This is an extraadrenal pheo or a paraganglioma.
Pros and cons. Ivabradine reduces heart rate. The paraganglioma is also slow rolling, no cancerine. Medication and other treatment can help control disease and symptoms and everything like cons. Ivabradine may cause excrete, AV blow, ventricular stress zone, and atrial fibrillation, but it can vary in as part of the body, becomes cancerous. Paraganglioma produce hormones such as catecholamine or adrenaline that cause hypertension. Uses application in Ecuador. At the Carlos Andrade Marine Hospital in Quito, in a period of 21 months and 26 cases of paraganglioma of the cardiac body, we were trapped. Evidence a high incidence of cardiac body tumor related to high and female sex. The reason for conclusion in all cases was the presence of now painful cervical mass. They underwent surgery for complete excision. They have not completed. Conclusion. Surgery to remove the tumor is usually the first treatment option for the paraganglioma, if often possible. If left untreated, paraganglioma can use a serial or life-threatening damage and can progress to the point that serial treatment is not an option. In people with gangrene or dismemberment paraganglioma to remote areas, medication after treatment can help control these and smooth symptoms and ever prolong life.
Paraganglioma, or para, is a rare, slow-growing neuroendocrine tumor that occurs in every gender, race, and age. Paras develop along the parasympathetic or sympathetic nervous system and produce too much catecholamines, which is a hormone that prepares the body for fight or flight reactions. Symptoms can include high blood pressure, anxiety, heart palpitations, sweating, headaches, and many more. Although it is rare, some paragangliomas do not produce any catecholamines, so symptoms may not appear. These are known as non-secreting tumors. Distinguishing para from other conditions can be a challenge. For secreting tumors, the 24-hour urine and blood plasma tests are the first step in receiving a diagnosis. A CT, MRI, or functional imaging can also help identify where, how many, and size of the tumors. Everyone diagnosed should talk to their doctor about genetic testing, because approximately 35% of diagnosed PHIOs and paras are the result of a genetic mutation, which can be passed down through children. Surgery to remove the tumor is the most common treatment. Before surgery, the patient must be blocked with medication to avoid a hypertensive crisis from a massive release of catecholamines during surgery. Non-surgical treatment options are available and listed here. Approximately 20% of cases are metastatic, which means it has spread to other parts of the body, but treatment options are available. Because para is rare, it is important to see an experienced medical team. All of this information can be overwhelming and scary. We are here for you throughout your journey, because together we are PHIO Para Fearless.
Now, thank you for your attention.